All right. So this was an adult study looking at the prevalence. What about in kids in the UAE? Is it the same? So this is a study by Dr. Brahim, also published in the WHO journal in 2021. And this is basically looking approximately at 3,500 kids from the age of 6 to 14. Here I'm showing the data for the kids in 13 to 14 years of age. And they looked at these patients from March to June in 2019 in Dubai and the Northern Emirates, as per the International Study of Asthma and Allergies in Childhood. And here, you can see asthma and wheezing from all causes, allergic rhinitis and hay fever. So really this was, when you tell a patient, do you have allergies? They may say no, but then you say hay fever. Yes, I have hay fever. So they included both the term allergic rhinitis and hay fever. So you see that most of these patients, approximately 55%, 53% of patients had allergic rhinitis followed by wheezing. And when you looked at the group younger than 13 to 14, they even had higher percentages. So same distribution, but higher percentages of patients with allergic rhinitis and wheezing from all causes. What about the common area allergens? I told you that house dust mites is the most common allergen in adults. So in children and kids, this is a retrospective cross-sectional studies looking at 180 children, 180 children from who actually underwent skin prick testing. And they were divided into less than 7, more than 7 females and males. But here again, among those who were positive on skin testing for IRA allergens, 90% approximately were polysensitized and 10 were monosensitized. The most common allergen again was house dust mites. So approximately 40% for DP and DF. So 2 types of dust mites. These are the most common types of dust mites. And the most prevalent indoor allergen in this group as well. So the most common allergic disease in this population was allergic rhinitis in up to 70% of the population, asthma in approximately 52%, and atopic dermatitis in 21%. What about the clinical pattern of severe asthma and the coexistence of allergic rhinitis in the UAE? This is a study done by Dr. Abu Zakuk and Dr. Fulvio and their colleagues. So this was a retrospective review looking at 458 patients with severe asthma as per GINA guidelines. And these patients came from 3 different tertiary care hospitals. This looked at the time between May 2015 and December 2019. And here in this group that they looked at, basically the most common comorbidity of patients with severe asthma was allergic rhinitis in 52.2%, followed by reflux, acid reflux in approximately 21%. They did have a female preponderance in their group. I wonder why. This is usually like outside of, you can comment on this in a bit. Maybe because in the Arab world, female are more vocative about their symptoms. I don't know. So you can comment about this at the end of this talk. So again, so asthma insight and reality. So we do have asthma in the UAE, but what about our insight into this disease? Are patients actually doing what they're supposed to? Are we doing it what we're supposed to? This is, to be fair, in older studies to 2010. So I hope we did come a long way from then until now. But this was a face-to-face interview of 200 asthmatic patients. And among this looked at the control and disease burden, as well as the treatment of these patients. So only 31% were familiar with inhaled corticosteroids. So that's like less than a quarter, like 31% only were familiar with inhaled steroids. And only 5.5% used these inhalers at the time. 67% thought short-acting beta agonist was the medication for asthma, and they didn't need to be on maintenance medications. And 57 believed that the SABA is the most effective drug controlling their asthma symptoms. So severe attacks of asthma were reported in up to 64% in the past year. So that was the year 2009. So hopefully we don't have the newer data. At least I couldn't find the newer data in the UAE, but hopefully we have come a long way since this study because these numbers are scary. So it is there. What about so asthma, allergic rhinitis is all over the world. It is a big problem here for us in the UAE. What about in the region? So this is looking at the clinical burden of allergic rhinitis in the Gulf. This is a multi-country study, cross-sectional study looking at patients from Egypt, Turkey, Kuwait, KSA, and the UAE. It was a telephone survey, and they included around 230 patients with confirmed allergic rhinitis. So if you look at the different numbers, so approximately 70% had severe allergic rhinitis as defined by the ARIA guidelines. So severe meaning that it is actually impairing their life. The RCAT score, which reflect the control of the symptoms, 54% said they were uncontrolled, and 60% across the board had work or school disruption and disruption in their social life and leisure activities. 58% as well, so around 60% of them also said it was disrupting their family life and home responsibilities. So although, yes, it's only allergies, it's only sneezes, it's fine, you're not going to die from your rhinitis, but it does really affect the patients on a daily basis, and it's really a very serious condition for that patient. So again, I found this study that I wanted to share as well. This was only recently published in 2023. And this is finally giving us real data on patients with the health-related quality of life on patients who have allergic rhinitis alone versus allergic rhinitis with asthma. So the higher the number, the worse the quality of life. And you see here in orange, patients who had both allergic rhinitis and asthma are significantly much more impaired in all their domains when looking at the health-related quality of life domains. So the management of rhinitis and asthma, you will probably tackle in different lectures, but I just wanted to touch upon this to stress a point. So allergic rhinitis, we usually say avoidance of your trigger. If you are allergic to cats and you have 10 cats, really all the doctors in the world will not be able to help you if you have 10 cats in your bedroom, right? So avoidance of triggers, pharmacotherapy, which is usually only symptomatic treatment, and allergen immunotherapy. And for allergic asthma, avoidance of triggers again, and pharmacotherapy as per GINA guidelines. And you do have here in small print, which you can't really see, it's the addition also of allergen immunotherapy to patients who are sensitized to house dust mites. And again, why allergen immunotherapy? Because allergen immunotherapy is the only disease-modifying treatment. All the other pharmacotherapy are only symptomatic treatments. So allergen immunotherapy can actually modify the underlying disease. What is allergen immunotherapy? We administer antigen extracts either subcutaneously or sublingually to alter the patient's immune response. So we're changing the way the immune system is reacting when you are faced with your triggers. So it's supposed to reduce symptoms, improve the quality of life, and in some patients, cure the disease. There is definitely a relapse rate, but it depends on the way you treat it. So it depends on how effective your treatment. So this is very effective if you have the right patient and the right immunotherapy. So it really has to make clinical sense to give that specific immunotherapy for that specific patient. It is, there's always concerns of adherence because this is a long-term treatment, so you have to set the stage for your patients initially. There is lack of knowledge, not just among patients, among also healthcare providers about how and when to give immunotherapy. And so this is these two slides. This is not published anywhere. This is based on a meeting that we had a while back where we had 12 allergists, pulmonologists, and ENT. Most of them did say that immunotherapy is effective, either effective or very effective in adult patients. And same thing goes for the pediatric patients. So everyone, if one did not have any experience and then everyone else said, it's effective and very effective. So it does work. So please do refer or prescribe it yourself if you are comfortable doing that. I'm not going to dwell on this a lot, but really what we're trying to do is by desensitizing meaning we're shifting from a Th2 response to a more T helper T regulatory cells response. So increasing your anti-inflammatory interleukins, and then kind of just decreasing the IgE receptors on your mast cells that usually are triggering your allergic reaction. The indications, which is important, so the indications are rhinoconjunctivitis, asthma, venom immunotherapy, oral allergy syndromes in certain patients who actually are severe enough, and food allergy. Not all food allergy, of course. Urticaria is not an indication for immunotherapy. And again, as I mentioned before, safety and efficacy of allergen immunotherapy depends mostly on selection of clinically relevant allergens. In conclusion, respiratory allergic diseases are definitely amongst the common chronic health issues worldwide and not just in the UAE. And these conditions do affect your patients profoundly, whether it's overall well-being or disruption of daily life and reducing productivity. So it's paramount for us to follow established treatment guidelines and consider disease-modifying options like immunotherapy. I want to leave you with some exciting news is basically a group of us came together, so be on the lookout for this article. A group of us came together and came up with this expert consensus on recommendation on allergen immunotherapy for the management of allergic rhinitis in the UAE. So it's going to be published very soon. And it can act as a good tool for you to guide your prescription of allergen immunotherapy in your allergic patients. Thank you.